conference is being recorded. If you have any objections, you may disconnect at this time. Now, I will turn the meeting over to Ms. Dora Garcia-Correa. Thank you, ma'am.
Good afternoon, everyone. My name is Dora Correa, and I'm from South Texas, the Rio Grande Valley, or what we like to call the tip of Texas. I'm a longtime community organizer, and I have been an educator of the Affordable Care Act within rural America since the first open enrollment. We've made a very large impact in the Rio Grande Valley, and it was with the support of many of our organizations and local officials that made it possible. Together, we supported our navigators and our counselors, working endless hours to accommodate our community and get them covered. Every year has been challenging, but it is nothing in comparison to the challenge that our president has faced to keep health care accessible to all. I have been very encouraged by his commitment to the cause, and it has given me the courage to build such a strong partnership of organizations in our community. Mr. President, I would like to thank you for your leadership and your guidance and for changing lives across America. You have supported us endlessly throughout this journey. You have given us words of encouragement. You plan the ACA and tomorrow, and you walk beside us now in this endeavor and the fourth open enrollment period. I am so honored and so proud to introduce the President of the United States, Barack Obama.
Thank you so much, Dora, and thank you for the incredible work that you've done in the Rio Grande Valley. I know you just signed up people tirelessly, and from vetting in-person assistance and the local Head Start programs, so that you can reach parents, hosting 24-hour enrollment events with elected officials, going out on field trips to help agricultural workers get themselves and their families covered. You have done it all, and for those of you who are listening, you should know that Dora's nickname is Dora the Explorer, because she goes after everything. And it's the reason that we've seen so much success all across the country is just because of people like Dora and all of you who are on this call. This is the largest call we've ever hosted from the White House. We've got over 25,000 folks registering from across the country, and that's a testament to how much passion and how many people are behind this effort. And all of you are so dedicated to helping people in your community get access to quality and affordable coverage. So I wanted to take a few minutes just to speak to you right now before we kick off our fourth open enrollment period on November 1st, because you've been working hard to get ready, and I want you to know that I am paying attention, and everybody in my administration is going to be working just as hard alongside you. Now, the good news is, thanks to the ACA, 20 million Americans have gained coverage. The nation's uninsured rate now stands at its lowest level ever. But we've got more work to do because we have millions more to cover. And I know that you've seen some of the headlines this week about premiums. They're increasing in some states, even though they're very stable. In one state, even they're declining. But I want to make sure everybody has the facts you need to be successful in your efforts to reach those who don't get coverage on the job, or don't qualify for Medicare, or don't qualify for Medicaid. Those are the folks who, for too long, fell through the cracks, and they were the people who ACA was designed to help. For them, if they're shopping in the marketplace in 2017, because of the tax credit to protect people from rising premiums, more than 7 in 10 consumers will be able to find a plan for less than $75 a month. And if they're a returning customer who is shopping around and selecting the lowest cost plan offered that has similar benefits, the average premiums would actually fall by $28 per month, or 20% compared to last year. So they actually decrease, not increase, by 20%. And these are the kinds of things that somehow are not always reported on. The one thing that's been a challenge, obviously, since we passed the Affordable Care Act is the politics of it, because there is a faction of people who are continually trying to root for failure, despite the fact that we keep on insuring people and folks continue to get help. bottom line is that most people are going to be pleasantly surprised at just how affordable their options are if we can just get them to see for themselves. This is not one of those things where they're going to be surprised or have to engage in guesswork. If we are able to get people to actually check out their options for themselves at healthcare.gov, they will find out that despite some of the headlines that don't always explain the fact that premiums going up don't necessarily translate into higher premiums for people who are getting tax credits. If they can just see that for themselves, then they will exercise that option. But, we're going to have to kind of clear the bugs off the windshield so people can see the road ahead. And that's where you guys come in. That's why what you do is so important. Because there may be people who haven't yet signed up for affordable care, are cynical or skeptical about the marketplace because of all the political noise around. And so they've never actually bothered to take a look to see if this is something that they could help them and something that they can afford. And I know the amazing impact you can make in your communities by helping folks get covered, because your work is one part recruitment. You're out there busting up misinformation and myths. You're a counselor and a friend as you help people make the right choice for their families. I have seen you do it. I saw the efforts that Milwaukee took in the Healthy Communities Challenge last year. They were opening up libraries for enrollment events, digital signs on county buses, and it reached tens of thousands of uninsured in that community. In Miami-Dade College, where I went last week, it's a school that set the standard for the way campuses should engage their students and faculty and staff and alumni to make sure they know what options are available to them to give them peace of mind and to save them money. And in fact, Miami-Dade was part of the inspiration of this year's Healthy Campus Challenge, our effort to work with campuses and local community leaders to reach the uninsured, both on campus and in surrounding communities. And I hope schools that are on the line will opt in to our Healthy Campus Challenge by November 1st, because there are tons of young people who are uninsured. They're the cheapest to insure. They've got the most affordable options available, but oftentimes when you're young, you think you're invincible, and you don't worry about it until, unfortunately, something happens. So I'm incredibly optimistic about the great work you're going to do during this enrollment season. And just so you know, we're not letting up here. Michelle and I and Joe Biden and Jill Biden, we're going to be right by your side. We're going to be doing, op-eds and calling into radio programs and, doing all kinds of PSAs and just getting the word out. And we just have to keep running through the tape until the end of the open enrollment period on January 31st and beyond. But the main thing I just wanted to say to all of you is I could not be more grateful for your commitment. This has been one of the honors and privileges of being president, was to see each of you engaging in this life-changing and life-saving work, and I'm grateful for that. But I want to end by not only saying thank you, but also recognizing the challenge we've got here. Because of the incredibly fierce political resistance around giving everybody health care, something I've never fully understood, why anybody run on a platform of people being uninsured instead of insured. Part of what we can do this time is to overcome the skeptics, to prove people wrong, and to provide momentum so that when the next administration comes in, they are starting from a position of strength and will be able to say, you know what, this program is working well, it could work even better. And, I think that this ends up being really a test of our commitment to health care over the long term, not just this open enrollment period. I think we're at a critical time where we have to show that this program works for people if they just see what their options are. And we're not going going to get that much help through the media. This is going to be a ground game. This is a matter of going door to door, campus to campus, friend to friend, neighbor to neighbor, person to person. You are the people who are going to make sure that this starter home we built with the Affordable Care Act ultimately delivers on the promise that every single person in America has health care. And in this process, I'm just one player, and the legislation is just the beginning. You are the ones who are going to really make an impact. And if you guys do a great job this time out, then it's not just the people you are signing up this time that are going to be impacted. You will create the atmosphere that allows us to make sure that we build on this progress, and ultimately, not only the millions of people who still don't have coverage in this country are going to get it, but all the generations to come who will be able to look back and say, this was the moment when we really delivered on a long-standing promise of affordable health care for every single person in America. They're going to be able to look back and say that those folks who were in neighborhoods, making calls, knocking on doors, working on their college campuses, they were the ones who did it. So it's in your hands, and I need you guys to really understand that. God bless you. I'm so proud of all of you. And with that, I'm going to turn over the call to Secretary Sylvia Burwell, who is going to be able to give you all kinds of details and updates in terms of how the ACA is working. Okay? Thank you so much, everybody. Sylvia?
Thank you, Mr. President, and thank you, Dora, for sharing your story with us today. And I want to thank everyone for listening in. As you all know, the main reason we are here today is because President Obama had the vision and the courage to get health care reform done, and you all had the courage and the conviction to implement it. And with this open enrollment, we have the chance to build on our progress. Last week, I shared our projections for open enrollment 4, and with your help, we hope to have 1 million additional sign-ups this year than what we had last year. And next week, the health insurance marketplace will be open for business. And this year, like each year before, we're putting the consumer at the center of our efforts. First, we're going to make sure everyone knows that financial help is available to make coverage more affordable. Even if they didn't qualify for tax credits last year, they may this year. And in fact, 32% of marketplace consumers will be able to buy a plan for $75 or less a month in premiums after tax credits. Second, we're going to continue to work to make it even easier to find coverage and enroll for it. We improved the tools to shop for and compare plans, including being able to compare plans on a single screen. We're providing a simple, easy-to-understand presentation of core plan features like cost sharing and provider network, so you know if your doctor's in or out. So people shopping for coverage can actually find the plan that's best for them. And third, we want to get the word out there to as many people as possible, that people are available to help, whether that's in person or on the phone, and that's where so many of you all who are on this call come in. We're going to do everything we can to make it easier for people to sign up, but we need your help to get people engaged and actually sign them up. You all are some of our most trusted voices in communities, and we know that's who people turn to. So we need you to do everything you can to get people in the door and signed up for coverage. We've been through 3 open enrollments so far, and many of you on this call have been there right beside us. Together, we've learned a few lessons about what works best. Based on what we've learned, here's how we think you can be most helpful. First, we've learned that it's important to reach people with the right message in the right way at the right time. So promote open enrollment in your local papers, on television, on radio, and in social media, especially during that lead up to that December 15th deadline, which is the deadline for people to get coverage on January 1st. And let me give you a couple examples. One of meeting folks where they are. GGP is a company that owns and operates regional shopping centers, and they're going to have navigators and assisters in their shopping centers in Dallas, Fort Lauderdale, and Atlanta. They'll even hand out background on the ACA and the marketplace to shoppers that are there. The second thing we've learned is that local coalitions are particularly effective, and we hope you'll reach out to your HHS regional office to get involved in your local enrollment coalition. These coalitions are already ramping up with new ideas and tactics. In Houston, the Enroll Gulf Coast Collaborative will be offering enrollment information and support at the multi-service health centers run by the Houston Health Department. They'll even stop by local colleges and universities to make sure that young Texans are getting covered. Finally, we learned that we are in good hands with each of you. This administration ends in January, and we're giving it everything we got for all 4 quarters, but your work is going to last long after. So keep up the great things you're doing in your communities to get help to people so they can get healthy and stay healthy, whether that's through the Affordable Care Act or other important health programs. And over the past several years, I've been fortunate to have the chance to meet people whose lives are so different from the work that you do. So on behalf of them, on behalf of our team here at HHS, and on behalf of everyone we serve, thank you. Together, we have given security and peace of mind to millions of Americans. Together, we've helped them get the care they need to live healthy and productive lives. And I look forward to finishing this next open enrollment strong, thanks to all of you. And now, I'll turn it back over to Beth.
Thank you, Secretary Burwell, and thank you to all of our advocates who joined today's call. We know that collectively you will be communicating with millions of uninsured Americans over the coming months, and we cannot thank you enough for your remarkable work. And as you remind folks that you are in touch with over social media and through other large amplification channels that open enrollment begins Tuesday, November 1st, we encourage you to use the hashtag #GetCovered, and encourage folks to check out their options on that very first day. We so look forward to our work together over the coming months, and thank you again for joining today's call.
Thank you for participating in today's conference. All participants may disconnect at this time.
Crazy Vlogs, peace.